I'm Danae, and I am a podcaster, digital marketer, a wife, and a mom. And I'm a cancer survivor. I've got 3 kids, Joshua, Tatum, and Melody. Really wanted to be a teacher and a mom when I was a kid. By the time I was in 4th grade, I was obsessed with Harry Potter. It's become something that I turn to, like it's my comfort series. Just suddenly one week when we were on family vacation, I went to put one of my contacts in on my right eye and I thought I had dropped it because I couldn't see out of my eye. Within a few weeks, I had been to see multiple specialists, multiple doctors. I just remember the doctor, he came in and he said, well, what do you think you're here for? And I just said, well, I have a retina tear and you need to fix it. And he said, well, I can't fix it. And it's not because I don't want to, it's just because there's actually a tumor that is pulling the retina up and I can't fix that. We have to treat the tumor first. And I think that he said tumor and I didn't quite initially connect it to cancer. Like tumor was still separate from cancer in that moment in my brain. But it was terrifying and I was alone. I called my husband and I think we were both in complete shock that I even had a tumor in my eye. We're meeting with the next doctor. She and I hit it off really well. I felt a lot more seen and understood by her. She's a mom herself and she could see just how hard this was with 2 kids and a baby. My baby was 9 months old. And that whole month was hell. Not only was I losing sight, I was also dealing with the idea of, well, what does this mean for the rest of me, right? And that became, kind of a burning question, I think. Castle entered the picture basically in my first appointment with Dr. Curley. So when she was giving me my second opinion, confirming that yes, I had ocular melanoma and that we needed to treat it with something, here were my options. Because my tumor was right at the front, she also said, I have really easy access to do what's called a biopsy. When we do the biopsy, we can get this teeny tiny needle-sized tissue amount that we can sample, and we can use that to basically inform our decisions about how do we approach your diagnosis from this point on. But she also explained that it was important information because it was kind of scary to get that idea of okay, well, you're going to give me more information about how high risk this cancer is. Do I want that information? I don't know. And she told me that one, I could decide to kind of not see it if I wanted. She could be the one to know. She could pass it on to my medical oncologist, and I could just kind of put my head in the sand if I wanted. And the other option was that I could know what the information meant and I could, kind of be a part of this process with her. And ultimately what she told me though is that you're not a statistic and I'm not going to treat you like one. That it was you have the highest risk of metastatic spread chance in 2 to 5 years. And I really had to just kind of buckle down and decide that I was going to use that information and I wasn't going to let it define me. I wasn't going to let the fear define me, because I couldn't afford to. If I wanted to live and actually feel like I could live presently, I didn't really have a choice. It was either crawl in the pit of despair and stay there or climb out and decide what I was gonna do about it. That summer was when I got sick. So we did scans and we did confirm that there was a new spot on my liver that had not been there at the original time of diagnosis. And so not only did I have metastatic disease to deal with, I now had an eye that the tumor was potentially growing and we had to get it out as quickly as possible. I had liver ablation surgery the week before Thanksgiving, and then 3 weeks later I had my eye removed. If I hadn't found out the information, I would have just stayed in this kind of limbo. It became an unknown that I could then research and I could do more with. And being that watchful, having those scans every 3 months, it's essentially what made it possible for us to find this little metastatic spot on my liver. Because if I hadn't had scans every 3 months, then it would have been, 6 months. And by then, who knows what could have happened. And I think that is one of the most powerful things you can do as a patient with a rare disease like this, is to really just understand it as best you can. And while I don't have, total certainty around what's going to happen in the future, I do have answers and I do have information and I do have just a level of, I think, assurance with finding that information and learning from it. And I'm going to be a nerd again, a Harry Potter nerd, and I'm going to quote Dumbledore, because fear of a name only increases fear of the thing itself. And for me, the diagnosis, knowing what it was called, knowing that it was called ocular melanoma and what that entailed, knowing my Castle test results, that was all part of knowing the name and not letting fear define the journey. As of a year ago, I had metastatic spread and I was given a stage 4 diagnosis. And today I am completely cancer-free. I had to really just learn how to show up for myself and learn how to advocate. So, it became kind of a gift in some ways, even though it was really hard at first. I'm here today and I'm gonna be here tomorrow, and eventually those tomorrows add up. And that's been the case ever since. So that's kind of my plan, is just keep living today and expecting tomorrow.